you. This system will notify you once you begin your
Welcome to
broadcast.
today's
The
training on adult
broadcast is
day
now
health
starting.
care
All
and
attendees
community-based
are in
adult
listen-only
services
mode.
program requirements. Today's training is presented by the California Department of Aging, and today's outline for the training is going to be that we're going to talk about the training objectives briefly, and then we'll go into a discussion about the CBAS program model, objectives, and eligibility criteria, some program basics. Then we'll spend some time talking about program authority, as in the laws, regulations, and waiver requirements that govern the community-based adult services program, the roles and responsibilities of the state, the Medi-Cal managed care plans and providers of adult day health care and CBAS, the certification standards, those would be the CBAS standards for being certified for Medi-Cal, and we refer to these standards as falling into 5 main categories. So we'll go over those. We'll talk about participant care more specifically, and we'll provide you with some resources and contacts. This is a very high-level training of program basics for adult day health care and CBAS. Today's objectives are that webinar participants will understand the basics of the CBAS program model, know the key elements of the CBAS program requirements for the purpose of meeting program standards and addressing participant needs, and to know how to access resources. A little bit about the program model as background. CBAS is a day health program. It provides services to older adults and adults with chronic medical, cognitive, and health conditions and/or disabilities who are at risk for needing higher levels of care, either hospital placement, institutional care, in nursing facilities. It's available to Medi-Cal participants through licensed adult day health care centers. So CBAS, the Medi-Cal benefit, is paid to providers of CBAS that run in adult day health care centers. It's available to eligible individuals as a benefit through Medi-Cal through the managed care health plans, and available through fee-for-service in limited capacity for individuals who are exempt from managed care enrollment. Primarily, it is a Medi-Cal managed care benefit. CBAS also provides daily nursing services, personal care and/or social services, therapeutic activities, and a meal each day the individual attends. Those are known as the core program services, and provides physical therapy, occupational, speech therapies, mental health consultation, dietary services, and transportation as needed to and from the center. CBAS as a program objective is designed to restore or maintain optimal capacity for self-care of the individuals it serves, delay or prevent inappropriate or undesirable institutionalization, and maintain individuals in their homes and communities for as long as possible. So let's talk about some of the CBAS basics as far as eligibility is concerned. Who's eligible to receive CBAS services? There are 5 categories of those who meet medical necessity for services, and they are: 1, nursing facility A level or above. We'll talk a little bit more about that in a moment. 2 would be that they have organic or acquired traumatic brain injury and/or chronic mental illness. Category 3 is moderate to severe Alzheimer's disease or other dementias, and those would be diseases that have characteristics that are staged at level 5, 6, or 7 by the Alzheimer's Association, and we'll talk later on about the resources that you can find to look at that those staging levels. Category 4, mild cognitive impairment, and that would be at stage 4 level, and then category 5 is developmental disability. More about eligibility. For each eligibility category, other diagnostic or eligibility medical necessity criteria also apply. So for example, criteria in the Welfare and Institutions Code, and there are the sections 14525 and 14526.1, also govern who is eligible for services in addition to those categories that we just described. And the second bullet, need for assistance or supervision with specific activities of daily living or instrumental activities of daily living that apply to those categories 2 and 4. Again, a little bit more in a moment. There's a website address right there as a link to provide access to a more expansive table that lays out the eligibility criteria for CBAS. It's available through that link. More on eligibility, determination, and authorization. This table is showing on the far left eligibility. Eligibility is determined by the Medi-Cal managed care plans and in limited capacity by the Department of Health Care Services for those few people who continue to be served through the Medi-Cal fee-for-service program. But again, primarily participants in this program are Medi-Cal managed care members. So eligibility is determined by the managed care plans. There's a link in this table to bring you to some information about how eligibility is determined by the plans, but ultimately CBAS providers work with their contracting managed care plans locally to find out what their processes are and to receive training from the managed care plans about their eligibility determination processes. There's a second link there to a standardized tool that the managed care plans use to determine eligibility for CBAS, and it is at that second link in the first box. Coming down in the table, individual plan of care. So there's an individual plan of care that is developed by the providers, and that is something that goes to the Medi-Cal managed care plan along with a request for authorization for services. Information on development of the individual plan of care can be found at the resource link in that box. It's on the Department of Aging's website, so you can find that link, the individual plan of care at that link. Level of service. Level of service refers to the number of days per week that an individual is to receive services at the CBAS Center. Remember, this is a day program, and the number of days per week that an individual receives services is something that is developed through a planning process with the participant, with the staff at the center, and so the providers recommend that level of service, number of days per week, to the managed care plan, but ultimately service approval in that last box includes, by the managed care plan, the authorization for the service and then the determination of the number of days that the individual will receive services. So we're going to go into some more detail about each of these processes, but this table shows an overview of the eligibility determination done by the managed care plan, the individual plan of care, which is developed by the providers, and the level of service recommendation that the provider recommends based on the level of need assessed for that individual, and then the service approval that happens through the managed care plan. So all of the resources and links there are provided for your overview. And we're going to go through these things in a little bit more detail coming up. A bit about the laws, regulations, and waiver requirements that apply to the CBAS program. Health and Safety Code Division 2, the link again is provided for you there. This is what's known as the Adult Day Health Care Act, and this information can be found on the web at the address listed, and you can request this a compilation of the codes that apply to CBAS and Adult Day Healthcare. You can request that of the Department of Aging. We'll have a resource list at the end of this document. But if you wanted to look up individual health and safety codes or look up the Adult Day Healthcare Act on the web, you can find it at that link. Welfare and Institutions Code, Division 9, speaks to the Adult Day Healthcare Medi-Cal law. So in this program where we have a Adult Day Healthcare license that is required in order to become certified to be a CBAS provider. All CBAS is provided in an adult day healthcare center. So the laws that are on the books for health and safety and welfare institutions address adult day healthcare, and those all apply to CBAS providers. So Health and Safety Code and Welfare and Institution Code are the law in the program. Title 22, Division 3, Chapter 5 of the California Code of Regulations specify the Medi-Cal certification requirements for adult day healthcare CBAS providers. Title 22, Division 5, Chapter 10 refers to licensing regulations, and both of those sets of regulations can be found individually at the link below. Again, if you are interested in obtaining a copy that has the entire set of health and safety codes, welfare and institutions codes that apply to adult day healthcare, and the Title 22 regulations, you can contact the California Department of Aging and we'll provide you with those documents. These links here will link you to specific sections, individual code sections that you may want to reference. Additional program policy and authority can be found in the Medi-Cal Inpatient Outpatient Provider Manual. The link, again, on the Department of Aging's website is the easiest way to find that. It's actually posted on the Department of Healthcare Services website, but this link will bring you directly there. And so there's policy that applies to overall to Medi-Cal providers, and so they apply to CBAS providers, and those policies can be found in the provider manual for Medi-Cal. Specific sections that refer to CBAS, and then also general Medi-Cal requirements. CBAS special terms and conditions and standards of participation. These are additional requirements that apply to CBAS providers, and they are found in the California 1115 Bridge to Reform waiver. That's California's demonstration waiver, the agreement that California has with the federal authorities at the Centers for Medicare and Medicaid Services. There's an agreement called the 1115 Demonstration Waiver, and in that waiver there are terms and conditions specified specifically that apply to CBAS, and then there are standards for participation for CBAS providers. So again, the links to those documents can be found at those two links, and these are also requirements that CBAS providers would want to have and access and be familiar with to provide program services that meet the requirements. So let's talk a little bit about roles and responsibilities that the state has in this program, that the Medi-Cal managed care plans have, and that providers have. A little bit about the oversight agency role. So for the state, there are three different departments that have authority in the program, in the CBAS program and adult day health care program. That would be the Department of Healthcare Services, the Department of Aging, and the California Department of Public Health. So some things that go on in each of these departments around the adult day health care program and CBAS program. The departments set policy and administer the programs. They license and certify CBAS centers and providers. So we process applications, conduct on-site surveys, and handle everything that has to do with licensure of the adult day health care centers and certification of the providers who are providing CBAS at those adult day health care centers. The state also administers the fee-for-service CBAS benefit and conducts face-to-face eligibility determinations, authorizes services, and processes payments. So again, to just reflect for a moment, the program for CBAS, there are roughly 32,000 people currently served in the CBAS program, so 32,000 Medi-Cal beneficiaries, and all but about 500 of those beneficiaries are served through Medi-Cal managed care. So there are a few people that are still in the fee-for-service Medi-Cal program, and for those, the Department of Healthcare Services manages their eligibility and authorization for services and payment of claims. But the vast majority of the participants for CBAS are Medi-Cal managed care members. The state also investigates various complaints and handles fee-for-service fair hearings. So when individual beneficiaries have issues with regards to their services, fair hearings are handled by the state. The state also monitors adult day health care and CBAS provider performance through various oversight mechanisms, including on-site reviews, maintains and reports program data. So there are all kinds of data tracking and reporting that the state does and works with providers to obtain program data to provide to various individuals, the legislature, the public, and to the Centers for Medicare and Medicaid Services. State provides technical assistance and training, also monitors and oversees managed care plans. So the Department of Healthcare Services manages the managed care plans through their contracts, the managed care plans that CBAS providers contract with to provide services. And the state coordinates various oversight activities. So there are 3 different state departments involved directly with adult day health care and CBAS, and so there's oversight activities that need to be coordinated among the 3 entities to ensure that the providers are delivering the services as required. Medi-Cal managed care plans, their role. They are responsible for determining eligibility, and in parentheses there you see the term face-to-face. So if you're not familiar with that term, the eligibility for the program is determined through a face-to-face evaluation by the Medi-Cal managed care plans. The registered nurses will sit down with prospective providers, prospective individuals who are going to receive CBAS services and go through a standardized process, completing a standard review tool to ensure that the individual is eligible to receive services before CBAS is authorized for that individual. So they determine eligibility for their members to participate in CBAS. The managed care plans also authorize and pay for services. So that part of the process resides at the Medi-Cal managed care plan at the local level. They also handle grievances and appeals for their members. They credential and contract with providers. So all CBAS providers must undergo the credentialing process required by the managed care plan locally and obtain a contract with them to provide services to their members. So there's a whole step that's involved in oversight with regards to credentialing and contracting that each of the managed care plans has with their CBAS providers and all of their provider network. And they coordinate their member care. So for individuals receiving Medi-Cal and being members of the managed care plans, the health plans have a responsibility for coordinating at various levels the care for their members and ensuring that they get the services that they need. And the CBAS provider role. Again, this is an overarching role. There's lots of things that the CBAS providers do, but essentially it boils down to you're going to deliver the CBAS program services in compliance with all of the requirements for the program, the licensing requirements, the certification requirements, and the managed care contract requirements. And you're going to provide core and required daily services that meet participant needs. Again, very high level, and we're going to get down into focus down into some specifics next. This slide is depicting something important to CBAS providers to understand how the certification cycle works. So in the center of that circle, that graphic, you'll see that CBAS centers are initially certified for a year. That is in the statutes for the program. So initial certification is for 12 months, and then renewal can be for up to 24 months. So starting at the top circle on the graphic, 6 months from expiration of the certification, an application is mailed by the Department of Aging. So you have a 12-month certification to start, and 6 months into it, you're going to get an application to renew. 45 days from the receipt, the provider is to return the application. So we will tell you when you're due to expire. Think of it as a contract that you have, a provider agreement that you'll have to provide CBAS, and 6 months before it expires, we're going to tell you it's going to expire, mail you application materials, and tell you what you need to do within 45 days to start the process of renewal. Before we renew, and before we do an on-site survey, because we conduct an on-site survey to ensure that you're meeting compliance with the program requirements, we do what we call a desk review. So we're going to do a process before we ever get to your center where we look at various documents and we evaluate what your standing is with regards to compliance with program rules to the extent we can before we go on site. We go on site prior to expiration of the certification, and we do a survey of the facility. We do interviews and conduct interviews with staff and participants. We observe program activities. We review administrative and health record paperwork, and basically go through an evaluation, a standard evaluation of the provider's compliance with the program requirements. When we get back to the office, if there are deficiencies identified where the center and the provider is failing to meet requirements, then we issue a deficiency report for which the provider, we're moving around in a circle there, the provider then develops a plan of correction. So we go through a process where, a formal process where as a provider you provide your plan for making all of the corrections, putting the action plan in place that will ensure that those corrections are made, monitored, and don't occur again. So we'll go through a process of approving a plan of correction, and then after all of that paperwork is completed, all that process is completed, we renew the certification. So once you go through that initial period of certification, then you can be certified for up to 24 months. And again, this is all per the Welfare and Institutions Code for certification periods. So let's talk a little bit about CBAS certification standards. So overall, and again, this is a reference to the Welfare and Institutions Code here for section 14552, where Medi-Cal certification requirements are specified. So they essentially include that the CBAS provider, when you're certified to receive, to provide CBAS as a Medi-Cal provider, you must do so in an adult day health care center. And that adult day health care center means that if you have that license, it means that you must meet all of the requirements for licensure. So the first standard for being certified to be a Medi-Cal provider in CBAS is that you meet all the requirements in the licensing laws and regulations. That you comply with program and scope of services requirements. So those are all the program requirements, all the components that you need to have built into your program. That you have all the required personnel, licensed and otherwise. That you employ personnel that are consistent with professional standards, so people who have the right experience, and you need to afford participants all their rights, including to keep them free from harm and abuse. That you employ staff who meet cultural, linguistic, and any other special needs of your participants, and that you have organizational and administrative capacity in place to deliver the services according to the regulatory requirements. So that's sort of a snapshot of language that comes directly out of the Welfare and Institutions Code, and we'll get a little bit more specific in the areas that these things, these requirements cover in a moment. So when we think of the CBAS certification standards here at the Department of Aging, we think about them as falling into 5 major categories, referred to here as the 5 buckets for easy sort of remembering. So the 5 main areas that the certification standards address are the facility. That's where you meet those licensing requirements to ensure that all of the what would be called the bricks and mortar, everything in the structure is in place and to ensure participant health and safety, and that all of the processes and structures that are necessary in the building are meeting the requirements. Next would be your administration and your organization. So where the provider meets the leadership requirements, you have all of the right people in place to guide the center and guide the staff to meeting the requirements, and policies and procedures in place and training. All of the things that we think of as being administrative or organizational are in that category. That you have the required staff, that would be the third bucket there. The staff that are required, the professional staff, the licensed staff, the unlicensed staff, that they have the right competencies, the right licenses, they're in the right numbers, because staff are required to increase in number as the number of people served by the center increase. So that's all about the staffing in that third category. And then services, that you have the service components necessary per regulation and law that comprise the CBAS benefit. So each of those service components are making up that category, and we're going to go into some detail about those in just a moment. And then the fifth category would be the actual delivery of participant care. So this would have to do with the participant outcomes that are expected, that you're evaluating the needs appropriately of your participants, developing care plans for them, providing those care plans, and monitoring and ensuring that, that things are changed as needed. So the fifth category addresses all of the participant care items. And there are laws and regulations and waiver requirements that fall under each of these categories, and we'll take you on a little bit of a tour of the CDA website here to show you, if we can click on that link and show where a document that's very handy and helpful to illustrate these 5 main categories and the certification standards. This is on the Department of Aging's website. Under program requirements, if you follow the link that we just clicked on, it'll pull it up, and you can look at more specifically the areas that require, that are referenced in the regulation, that are referenced in the laws, the standards of participation in the waiver that address various areas. So, and again, these are not all of the requirements, but these are the major categories. So just to take a quick look. So with regards to the facility, there are lots of requirements that define what a clean and safe facility is, that specify what a therapeutic setting is. So if you look under 1A, B, C, that you have a license capacity that you are to operate within. So those are the conditions of the license. So a licensee cannot exceed the license capacity. And there are various other issues listed there. So again, the licensing requirements are pretty extensive, and we've called out a few of them here that the Department of Aging looks at as part of the certification sort of basics that we will focus on with regards to the facility. The California Department of Public Health also looks at facility requirements. And then coming down the list, we have in this document administration. So here's where we overview the people that are involved in the administration in the center, the administrator, the program director, and then we start looking at policies and procedures that we ensure that you meet all of the HIPAA requirements for protecting health information, that there are the program is designed to meet the special needs of participants served, whether it's languages and ethnicities or special diagnoses that you're focusing on at the center. That's all considered to be part of the administrative and organization part of the program. And then systems and reporting, that you have the capacity to meet all of your reporting requirements. That's all administrative and organizational in the standards for certification. Coming down, staffing, it goes through all of this document, takes you through all of the required staff and their qualifications and their role in the center. And then the next component gets into services. We're just taking a quick look at this. I want you to see that there's a good reference tool out here. We get into services under category 4, and then that talks more specifically about each of the components of the program and what's done as part of that, say, for example, nursing component. What does it consist of? It consists of a lot of things that have to do around medications, in medications training, medications monitoring and administration, liaison role that nursing has with participants, physicians, observing and monitoring of health status, continence training, health education, etc. Lots of program components that come straight out of the regulation and laws. So that's how this document basically reads, and then we'll finish up there at the bottom with looking at, it goes through each discipline of the program components, and then participant care and some key things that we've called out here for you to be aware of for certification standards in laws and regulations around participant care and what happens at the participant level in the center. So just wanted to take a quick tour of that. We'll go back out to the rest of the slideshow here. This is just a high-level overview, but I want you to make sure that you know that there are great resources out there on the CDA website for you to get more information on this subject. So these slides just sort of reinforce some of the things that are in that document, so we'll just keep scrolling through here. We just saw the facility, that's the administrator, this is the staff. Let's pause here for a moment, and I just want to focus on this. Again, the standards document that we just looked at provides a great deal of detail about each of these staff members that make up the center staff. But one of the things I would like to call attention to here is that this looks kind of like the hierarchy of an organization chart for a good reason. In the regulations, the administrator is the individual who's in charge of the center. The administrator sort of sits atop of the operation, has a very specific role defined in regulation around hiring, training, firing staff, ensuring that staff understand sort of the chain of command and their roles at the center, ensuring the center operates in compliance with all the program rules. Those are all the administrator's duties. And then next in line is the program director. The program director is the on-site, on the program floor lead who oversees the nurses, social worker, activity coordinator, therapist, everybody who's providing services in the center. The program director sits over them on a daily basis as the sort of floor supervisor. So again, each of these staff have very specific roles that are defined in the laws and regulations, and those are reflected, I think, quite well in that standards document that we just looked at. And then this is the fourth bucket there, CBAS Center Services. We just went through that. I want to focus on this slide just for a moment to highlight that earlier when we were talking about the services that are provided on a daily basis, we referred to the core services. So core services at the CBAS Center are services that are required to be provided each day of attendance at the center. So each individual needs to receive, every day that they attend the center, professional nursing services. And professional nursing services are also defined in law. Social services and or personal care services. So they would need either one or the other on each day that they attend. They get therapeutic activities each day that they attend, and they have to have a meal at least offered. Some people may not be able to consume it each day, but they have to have a meal offered each day. So those comprise the core services at the CBAS Center on every day of attendance. Additional services to that are provided based on the assessed need of the individual and as scheduled on their individual plan of care. So those consist of the therapies: physical therapy, occupational therapy, speech therapy, mental health services, dietary services, and transportation as needed. So those would be additional services that go beyond the core. So a little bit more detail provided in this slide on the nursing discipline. So some core services, again, because this is a very high level overview training, mostly to give you direction as to where to find more information. This is focusing on core nursing services. So that WIC at the top of the slide, Welfare and Institutions Code, and there's the section 14550.5, defines what's meant in adult day healthcare and CBAS as professional nursing services. So it consists of observation, assessment, and monitoring of general health status, changes in condition, risk factors, and these are basically, they go to why is that individual getting services at the center. These are the nursing services that are being provided, those that are focusing on the conditions for which the individual was enrolled at the center. Number two, monitoring and assessment of medication. So medication plays a big role in the lives of the individuals who are eligible for CBAS and are being served in the centers. And so nursing, not surprisingly, is focusing a lot on medications, medication regimen, administration, prescribed medications, intervention as needed based on assessment and reactions to medications. Oral and written communication with the participant's personal health care provider. So all of that liaison that the nurse does back and forth with the physician, the family or caregiver regarding changes in conditions and important signs or symptoms. These are activities that are core at the center with regards to nursing. Supervision of personal care services and assistance, and then provision of any skilled nursing care and intervention within the scope of practice of the nurse and based on assessment at the center. So these are the more invasive types of interventions that the nurses provide that are considered to be skilled interventions per their scope of practice. So those are the 5 professional nursing services defined in the law. Also in regulations, some more on nursing. Each service category, so thinking about each of the categories of service in CBAS, the nursing, the social services, the personal care, the activities, the therapies, each of them have further definitions in regulation, law and regulation. So for nursing, for example, in the regulations, you'll see that the nursing program consists of assistance with activities of daily living and instrumental activities of daily living. Medication administration, again, continence training, liaison, and help with obtaining other medical services that the CBAS participants may need. So further elaboration on the responsibilities of nursing, the nursing components of the program to be found in regulations. and some on personal care services with regards to further talking about the core services that happen daily. Again, more information and definitions under the Welfare and Institutions Code, but basically on every day that the individual attends either personal care or social services, and they're defined right here in the law. What does that mean to get personal services or social services? It means that under personal care services, they're either getting supervision or assistance with activities of daily living or IADLs, instrumental activities, or they're getting protected group supervision and interventions to ensure their safety, minimize risk, accident, etc. And then category 2 would go to the definitions of social services provided by the ADHC social worker or social work assistant, and that includes observation, assessment, and monitoring of the participant's psychosocial status, any group work to address psychosocial issues, or care coordination. So those are the definitions that are in the statute. And again, more information in Title 22 of the regulations for social services, where it specifies what are social services. Well, they include both individual and group counseling, liaison with the participant's home and family, coordination with community agencies to address participants' needs, and avoid service duplication. So some amount of sort of care coordination that happens at the social services level in the CBAS Center. Again, specified in regulation, these are requirements for social services. All right, so a little bit about core therapeutic activities and meal. Again, we're still going through those services that are required on a daily basis. So therapeutic activities kind of break off into a couple different categories: group or individual activities to enhance social, physical, or cognitive functioning of the participant. So a wide range of activities, both physical, social, cognitive, to assist the individual with functioning and optimal self-care. Number 2, facilitated participation. So for those individuals whose frailty or cognitive functioning level precludes them from active participation, they're still at the CBAS Center having some participation in the program facilitated by the center staff. And then there's the one meal that's provided each day of attendance, and some caveats there. If the participant declines or they're medically contraindicated, that's acceptable. You just need to make sure that that's documented in the participant health record. A little bit more about core activities. So activities include social, purposeful, independent, and group. So both independent and group activities designed to promote restoration of capacity for self-care, mental and physical well-being, and it should involve, the activity should involve the individual. Each individual is assessed for activities, and they have an individual plan that's developed, and they should be very involved in developing that plan, selecting their activities, and actually can participate in the delivery of those activities as well. There's a note here on this slide that indicates that therapeutic activities also include maintenance program active services, which are defined in the Health and Safety Code, and there's the reference there. Maintenance program services include procedures and exercises that are provided to maintain the existing function, just general sorts of procedures and activities and exercises that are planned by the licensed therapist and provided by someone trained by the therapist that assist with maintaining function. So now we're kind of in that fifth category still of the certification standards, the one for participant care. And so some points to emphasize here. The CBAS Center has what's referred to as a multidisciplinary team. Those are the individuals that we were talking about under the slide with the entire staff listed. It's the nurse, the social worker, the program director, the activity coordinator, and the therapist. So the multidisciplinary team works together to conduct assessment of individuals, to identify need, and then develop an individualized, person-centered plan that's designed to address those assessed needs, the problems, treatments, and interventions and goals to be achieved during a 6-month or 12-month period of time for services. And those are the services that are scheduled on the individual plan of care. And the participant's progress is monitored, and the IPC is revised as indicated. So this is what we refer to, if we click to the next slide, we have a little bit more on care coordination. We refer to that as the care the care planning and care delivery loop. And we have, I think, a graphic here that will explain that a little bit more. Also in participant care, coordination, liaison is required. And liaison is defined in the statute here, the process of obtaining information from or providing information to the participant's family or caregiver, participant's personal health care provider, including mental health providers, or social services agencies to facilitate the delivery of services designed to meet the participants' needs as identified by that multidisciplinary team. I would also add that not in the statute but in the waiver is the requirement that care coordination happen between the provider and the managed care plan for that member. So working together collaboratively to make sure that there is information being exchanged to ensure that care is provided. So what happens next is that we have a care planning loop, I believe, if we move the slides. So we have components and sequence. Okay, so access and problems are identified through the initial assessment. Then a care plan is developed that includes measurable goals. We provide services and interventions based on those assessed needs and those problems that are in the IPC, and we deliver services accordingly. And then document services and interventions and participant response to the interventions in measurable terms on flow sheets and progress notes that are part of the health record, and then reassess problems and needs, including progress and lack of progress in reassessment and quarterly notes, and then revise the care plan based on that reassessment. So this is the way that the care planning and care plan loop sort of works, is that the identified needs come first. The team identifies the needs through initial assessment. They develop a care plan, including measurable goals. They provide the services, document those services in the health record, reevaluate how those services are working, the participants' progress, and then make revisions to the care plan based on that and start all over again with delivering the services. And there finally is the care plan loop. So again, just a graphic to represent what we were just talking about with regards to care planning, provision of services, documentation of the services, reassessment for services, and around the loop goes for delivering that care that's needed for the individual. So CBAS key program requirements. This is a slide that depicts some of the things that have changed in the CBAS program. Most recently, in December 2014, there were changes made to the 1115 demonstration waiver, the agreement that California has with the Centers for Medicare and Medicaid Services for delivery of CBAS. And so some of those changes that are very important for individuals who are, and providers who are not familiar with some of the rule changes. Providers contract with managed care plans to deliver services to Medi-Cal managed care beneficiary, Medi-Cal managed care members locally. And previously, all managed care plans were required to contract with all willing CBAS providers. That is no longer the case since the terms of the agreement were amended in December of 2014. So now there's what's called selective contracting. So managed care plans are not required to contract with all CBAS providers. They are able to shop for CBAS providers, credential CBAS providers, and contract with those that meet the needs of their members, that are located where they need them to be located, that are delivering specialty services and meeting the needs of their members. So selective contracting by the managed care plans now in CBAS. Payment rates have also changed. Previously, the published fee-for-service rate in the Medi-Cal program for adult day health care and CBAS, it was required that the managed care plans paid at that per diem rate, meaning each day a participant attended the center and attended for the minimum 4-hour time frame. Then the managed care plans were required to pay them a per diem rate that was set by the Department of Health Care Services. That is no longer the case. There is no floor or ceiling to the rate, nor is there a requirement that the managed care plans pay on a daily basis. They may pay by various other methods. So they could pay by an acuity-based rate or a monthly rate. So changes that are pretty significant in the payment for CBAS services. Also for authorization for services. So services in the laws and regulations for the program are discussed in terms of 6-month periods of time. Providers are still required to assess and develop care plans on a 6-month cycle. However, the managed care plans that contract with providers may allow a 12-month period of time for authorizations. So they may just require that the CBAS provider submit an updated care plan if there are changes within the 6 months, within the 12 months, but they are not required to authorize every 6 months as previously was required. So again, this is something that the managed care plans and the providers should be discussing at contract time and being clear on the rules for authorization. And then the face-to-face eligibility determinations also changed in December 2014. So managed care plans are allowed now to waive the face-to-face requirement, meaning each individual who's coming new into the CBAS center, has never been served before, previously was required to be evaluated face-to-face by a registered nurse from the managed care plans to determine that they were eligible, met the eligibility criteria. That is no longer the case as an automatic requirement. Managed care plans may, when they know that member, they know certain information about them, that they understand that they are eligible, they meet the criteria, they may not have to do the face-to-face. Some other key changes, plan and provider coordination. So there's new requirements that came into place in December of 2014 for provider and plan coordination, exchange of important information when there are changes of condition, when there are needs to coordinate care, and those include some new reporting requirements for discharge of participants and incidents that happen, unusual incidents that happen to participants while they're at CBAS centers. So CBAS providers are required to provide that information to the managed care plans, and the managed care plans are required to obtain that and ensure that it's obtained from their contracting providers. And there's also home and community-based settings rule requirements and new CBAS center policy that came into play. New CBAS centers are being allowed to be open. That wasn't happening for many years in the program. No new certified adult day health care providers when we were adult day health care as a Medi-Cal benefit, and then CBAS providers were not being certified, new providers for some time, and now new CBAS centers are being allowed. If you're interested in that, you're talking to the California Department of Aging about obtaining materials on that subject. And the HCB settings, the home and community-based settings rule, federal requirements that the CMS put into the waiver in December 2014, charging California with developing a plan for ensuring that all of our CBAS centers meet requirements at the federal level for home and community-based settings in the CBAS program, and they're all in compliance by 2019, that would be March of 2019. Lots more information about that on the website, CDA website. So here are some additional resources, important resources to access if you're new to the CBAS program to get your bearings. The California Department of Aging website, and we'll go on up to that in just a moment. The Department of Healthcare Services website. Department of Healthcare Services Medi-Cal Managed Care. It's where you'll find the list of managed care plans, where they are in each county, their contact information, etc. And managed care plan, all plan letters. These are policy letters that are issued periodically by the Department of Healthcare Services, and oftentimes they specify requirements that the managed care plans have in dealing with CBAS providers. So it's an important place to access and check policy letters periodically. And the last box there is the Department of Public Health licensing website at that link below for licensing requirements and applications, etc. So let's take a look at the Department of Aging's CBAS website for a moment. We have lots of information out there for new providers and new individuals to the program, where you can get orientation to the CBAS benefit. So program requirements, we have out there forms, guidance documents, various announcements, and we have what's called our CBAS dashboard. And on that dashboard we have statistics and information about what's happening with the program statewide. The graphic that's here on this, over to the right on this slide, is where we have some button bars on our CBAS page that will provide a lot of very helpful information. And I think we'll click on this link and we'll bring up the website just to give a quick tour around what kinds of information is available here. So there's information on the 1115 waiver. We've been talking about that throughout this brief overview slide presentation. There's information, just basic information about the program, if we could hover over the program overview there. So just basic information about the program there. And we have some background information and statistical information that the Department of Aging provides each year regarding the program. Some very specific information about program requirements. That's where you'll find some information about eligibility that we talked about earlier. There are center listings out there where you can look at where there are CBAS and adult health care centers around the state. There's a forms and instructions tab here for all of the various forms, from applications to reporting forms that CBAS providers use. There's a training button there where you can find training modules and past trainings that have been conducted for CBAS providers. Archives button where we put things that sort of become out of date, but where we keep things for reference. And then if you scroll down to these bigger buttons here, if you would like to receive CBAS updates, it's an electronic newsletter. You can subscribe by clicking on this button, and you want to look at any past newsletters, you can click there. Lots of good updates that we put out to the stakeholder community and all the providers monthly, with information and links and whatnot about all things CBAS. Each of these buttons here, the CBAS dashboard, will take you to a lot of interesting information about the CBAS providers around the state, the oversight activities, and participants that are served. We'll click on that in a moment. Information about stakeholder activities that are going on at the department for CBAS, lots and lots of information and references there. The next button down is all center letters. These are letters that we send to CBAS providers here at the Department of Aging that clarifies policy, clarifies program requirements, provides more official types of announcements that may or may not go into our CBAS Updates newsletter. So all kinds of communication we have with our CBAS providers through those all center letters, and they're all filed there. And then we have an external links button there that will provide some references needed to Department of Healthcare Services, Department of Public Health, etc. Let's pop out really quick and just show a little bit of the CBAS dashboard there. And again, if you're looking for information about CBAS centers around the state, there's CBAS, the CBAS center overview, the distribution of centers around the state, CDA oversight, center owners for CBAS, there's ownership information, and characteristics about the participants served. So lots of program information that we keep up to date regularly on our dashboard. And then if we could just really quickly take a look at the all center letters, we'd just like to show what we have that has past sort of policy and issues. So these letters are issued and filed annually, and so you can see that right now we're on the 2015 letters, so you can see the types of things that are out there regarding the last one, for example, home and community-based settings requirements. These are the federal requirements we were just talking about, and how the Department of Aging is focusing our monitoring and surveying efforts to ensure that those federal requirements are met. So lots of good program information out there. So that's just a quick sketch of what's on our CDA website that you can make yourself familiar with to help with understanding the program. And then back into the slideshow, I think we just have one more reference resource document here, one more resource slide, and that shows you CDA on the web to get you just to the Department of Aging's landing page, and from there you can get to CBAS or find out all kinds of things that are happening at the Department of Aging, and you can also get to the Department of Healthcare Services through links on our website. There's our address right there, California Department of Aging, our email address as well. That's our main CBAS mailbox that you can talk to us, ask for information, ask questions, etc. And there's our phone number. So that's the entire quick overview of ADHC and CBAS program requirements. I encourage you to take a look at the references in these slides, the different links that are here, and the references that are in the standards for certification and each of these, the laws, regulations, and waiver requirements that go along with each of the slides that we covered today to get further familiar with the program. And that's it for this session, so thank you for participating.